Hi, my name is Dr. Abiola Olusegun. I'm a herbal medicine practitioner. We are in Breast Cancer Awareness Month, and how women should prevent breast cancer and take care of their breast is very important, because breast cancer is a terrible health issue, and every year more than 100,000 diagnoses are done, and so we need to try our best to prevent it. When it comes to breast cancer, there is something we need to be careful of. That is our diet. Most of the diets nowadays contains a lot of chemicals, and these chemicals interfere with our hormones, especially female hormones, estrogen, prolactin. When these hormones are excessive or too low, the reproductive system begins to develop certain problems, and it has to do with the breast also. Women also expose themselves to a lot of chemicals like cosmetics, cream, perfumes, and all these chemicals together causes a lot of damages to the endocrine system. Now, what is breast? The breast is the tissue overlying the chest, that is the pectoral muscles. Women's breasts are made of specialized tissue that produces milk, that's the glandular tissue, as well as fatty tissue. The amount of fat determines the size of the breast. The milk producing part of the breast is organized into 15 to 20 sections called lobes. Now, every woman needs to take care of her breast. They need to dig out confidence and prevent breast cancer. How do we take care of the breast? What are the prevention and control of breast cancer? One is exercise. Exercise helps our body to regulate hormone levels. And why it may help is because fat cells produce estrogen, and high levels of that hormone, which is the estrogen, have been linked to certain cancers. Working out can shrink the size of fat cells, so your body pumps out less estrogen. The American Cancer Society recommends getting at least 150 minutes of moderate intensity exercise per week. Ideally, it should be spread out, not all at once. So, if your time is limited, exercising at high intensity for 75 minutes a week will have the same benefit. And the second one is maintain healthy weight. Maintain healthy weight. The best way to prevent cancer is to drink and eat like you have cancer. Don't just eat well, eat right. That is the best way to prevent cancer. So you maintain a healthy weight, because extra pounds equals an increase in estrogen production. And to protect yourself, you need to stay within the healthy range for your height. So you need to check your BMI levels. Then get screening on time. It is very, very good to go for routine checkup. Though every woman is different, so we have included both the basic rules by age for protecting your pair and some special circumstances that may require a closer watch. If you are within 20s, you can go for clinical breast exam once every 3 years. You can do breast self exam. That typically play a small role in finding breast cancer, but it's fine to do them if they give you peace of mind. They can help you familiarize with the look, the feel, and monthly shifts of your breast, making it easier for you to spot any changes in your breast. And if you are within 30s, you can do the clinical breast exam once every 3 years. That's if you have a family history of breast cancer, especially in a close relative like a parent or sibling. You can talk to your physician about when you should start getting regular mammograms or MRIs, as she may want you to start now rather than later. So it is better to always go for the screening, go for the routine checkup once in a year. But be sure to tell your doctor, not only the relatives which have the breast cancer, but also at what age they first developed it. That is necessary. Then if you are in your 40s, mammogram and clinical breast exam should be yearly. In fact, the American Cancer Society recommends that women get a yearly mammogram screening starting at age 40. The U.S. Preventive Services Task Force, however, advises most women to wait another decade and get a mammogram every 2 years. So if you haven't yet discussed your risk factors and lifestyle choices with your doctor to determine the best schedule for you, clinical breast exam should be yearly. Then from 50s and up, to do the mammogram and clinical breast exam, you should continue to get both these screening tests annually for the rest of your life. That is advisable. And the American Cancer Society recommends it, that you should do it yearly for the rest of your life. Although some experts do put an upper limit on how late in life you should keep getting your annual mammogram, but American Cancer Society advises that all women should continue to have one every year throughout their entire lives, just as long as they remain reasonably healthy for their age. Then you have to know your body. Know your body. It is important to be familiar with how your breast usually look and feel. That way you'll be better able to spot any changes, so you can report them to your doctor. And if you want to do self exams, the best time is whenever your breasts are not swollen or tender. That's when they are, as they are for many women before or during their period, their breast is always tender or swollen. So that's not the best time to do the breast self exam. Then don't lose it over a lump. It's quite easy to be afraid during a self exam if you notice anything or there's some perspective. But 4 out of 5 lumps felt in the breast are benign. They are not cancerous. So many times a new bump turns out to be a cyst or fluid-filled sacs associated with hormonal fluctuations, though a new lump is probably not cancer. So you can get it checked out by your doctor just in case. It is better to be on a safer side. Then fill up on fruits and veggies. Eat your vegetables and fruits. Diet is one of the most important modifiable risk factors for preventing and controlling chronic diseases, including breast cancer. So eat your vegetables and fruits. This may actually help you to curb cancer. Several recent studies have suggested that eating a lot of fruits and vegetables may be associated with a lowered risk of developing estrogen receptor negative breast tumors. So this is due to the fact that produce tends to be rich in carotenoids. Carotenoids are natural pigments that often serve as antioxidants. Estrogen receptor negative breast cancer make up only about 15% of all breast cancers, but they are particularly hard to treat. So it is better to let your diet be mostly fruits and vegetables, especially when you are in your 40s. From 40s, your diet should be more of fruits and vegetables. That was why I said the best way to prevent cancer is to drink and eat like someone that have cancer. Drink and eat like you have cancer. Don't just eat well. You eat right. Eat right. Don't say because you have the money, you eat anyhow. No, you have to watch your weight. Some findings also indicate that Greater intake of vegetables and fruit is associated with a lower risk of breast cancer in women. And also consumption of fruits and vegetables in your daily diet is emphasized for prevention and control of breast cancer. So you need to watch what you take in. You have to let it be more of fruits and vegetables. Then avoid alcohol. Don't drink alcohol. In fact, drinking even small amounts of alcohol is linked with an increased risk of breast cancer in women, because alcohol can increase the levels of estrogen and other hormones associated with breast cancer. That is why I say don't drink alcohol at all. Alcohol users are more likely to have increased amounts of folic acid in their systems, and this can lead to increased cancer risk. And also, alcohol may increase breast cancer by damaging DNA in cells. So you should avoid alcohol. Avoid it totally. Then it is good to get a good night's sleep. Get a good night's sleep, because staying up late can result in greater exposure to light at night, which suppresses melatonin levels. Melatonin, we call it sleep hormones. It is the brain that produces it in response to darkness. You know, there are some people that 12 o'clock they are still with their phones. This is not advisable. It is not advisable. And staying up late can be a problem, because even research suggests that melatonin may help regulate estrogen. And this is another reason to turn in early and get 7 to 8 hours sleep. Exposure to light at night can block melatonin production. So you should try and get a good night's sleep. Sleep on time. Sleep on time. It is very, very good. And if you are to sleep for 6 hours, it should be a sound sleep. If you have a sound sleep for just 6 hours, it is very okay. And take folic acid. Because not eating enough folate, I mean the naturally occurring form of folic acid. So not eating enough folate is linked with impaired ability to repair DNA. And damaged DNA has in turn been linked to cancer. Folate, you can find it in foods such as spinach and black eyed peas. You can find folate in it. So then you eat dark grapes. Eat dark grapes. The skin of grapes may have anti-cancer properties, although the research is not definite yet. But the antioxidant, that's the resveratrol, which is found in grapes, may protect your cells from damage that could lead to cancer. And yes, this same resveratrol that other studies have suggested that it may have heart benefits as well. So it is very, very good. So it is better to make a point of reaching for either unsweetened grape juice or whole grape as a healthy snack. And there are some things to avoid to prevent cancer. There are some things you need to avoid. Now you need to avoid refined oil. Avoid refined oil. Avoid milk of animal origin. Avoid all those. I do tell people to avoid cubes. Avoid Maggi. Avoid them. Then you should avoid consumption of gasified juices of different breweries, because most of them have 32 pieces of sugar per liter. So avoid them. Avoid microwave eating. Avoid mammography before delivery. You can do breast ultrasound instead. Then don't wear too tight bras when going to work or after returning from work. Don't wear too tight bras. Then avoid contraceptive pills. They are not good because they change the woman's hormonal system and it gives cancer. The contraceptive pills increases the estrogen levels in women and it causes cancer. Then deodorants, they are dangerous, especially when you use them after shaving. They are dangerous, so you should avoid those. Then Sugar, avoid sugar totally. You can use original honey instead, because cancer cells eat mainly sugar, and every sugar now is synthetic, even the brown sugar. So it's better to avoid it permanently. Avoid sugar. A cancer patient who suppress sugar in his diet seals his disease, regressed, and can live long. So sugar, I usually say sugar equals deadly enemy. So avoid sugar totally. And avoid alcohol. I've told us before, avoid it. A glass of beer stays 5 hours in the body, and during this time the organs of the system are operating at idle speed. So it is better to avoid alcohol. And there are some things you can do or eat to prevent cancer. Vegetables, for example, like broccoli, cauliflower, cabbage, kale, spinach, beans. Eat those vegetables like that. They prevent cancer. I have told us the best way to prevent cancer is to eat right, not just eat well. Eat right. Eat like you have cancer, so that it can be prevented. Don't just eat anyhow. Your lifestyle really matters when it comes to cancer. So eat enough vegetables. Take honey instead of sugar. Take the original honey, not the one that is even sweeter than sugar. Then take vegetables. I've told us, take vegetable proteins. Like when you are eating beans, you eat it with fish. But from 40s, you should limit your intake of meat. So eat beans with fish. Those are the kind of vegetable proteins I'm talking about. Then early in the morning, it is advisable to take 2 glasses of warm water on an empty stomach, even before brushing your teeth. Take 2 glasses of warm water on an empty stomach. And there are some juices, there are some anti-cancer juices that you can take to prevent cancer, like mixing aloe vera with ginger, with parsley, with celery, with bromelain. That's the middle of pineapple. You can mix them together and drink on an empty stomach. That juice also prevents cancer. Then another juice that you can do is mix soursop. Soursop, you remove the seed, you mix it with bromelain. That's the middle of pineapple. That is also an anti-cancer juice that you can take. And it is advisable to also eat raw or cooked carrot, or juice the carrots each day. It is very, very good. It is advisable. And there are also some herbs that you can actually use to prevent breast cancer, like pawpaw leaves. Pawpaw leaves is very good to prevent cancer. If you are scared of cancer and you are looking for a natural shit to ensure your health with, in a world full of many carcinogenic substances, then using papaya leaves will work very well for you. Use the papaya leaf extract. It will work very well for you. While the oxidants, the digestive system, and other nutritional factors in papaya can provide protection against developing cancer. Recent research studies have also showed that papaya leaves have potential as a treatment for those already suffering from the disease. So papaya leaf extract is very good to prevent breast cancer. Then jute leaves, that's ewedu. Jute leaf is also very good. It contains so many nutrients. Drinking the extract of jute leaf is also very, very good. And it has so many nutrients that are beneficial to the health, that can prevent breast cancer, like the vitamins A, C, and E that are in jute leaf. Is the key to ward off damage that can cause it ward off tissue damage that can cause cancer. And inside it, there are also some antioxidants and lignin that can provide protection against development of cancer cells. They also inhibit the incidence of tumors and increase the lifespan for breast cancer patients. Then neem leaves is also good. It detoxifies the system. It improves immune response, it eliminates free radicals and inhibits inflammatory reactions. And neem leaves also destroy cancer cells. So neem is very okay to prevent cancer cells. It is very okay. Then when you do all these things, it can actually prevent breast cancer. So there are some signs of breast cancer I also want to discuss with you, that when you feel these signs or symptoms, it is better to go for checkup. You know, when most people think of breast cancer detection, they think of a lump in the breast, and this is a possible warning sign though, but it is not the only one. It may also not be the first one to develop. So there are some other common signs of breast cancer, which includes lump inside the breast or underarm area. Then changes in breast size and shape. At times you may feel pain in a specific area that does not go away. And prominent veins on the surface of the breast. Nipple discharge that starts suddenly when you're not breastfeeding. A sore or rash on the nipple. These are part of breast cancer. There can also be swelling or redness in the breast. Then dimpling on the skin on the breast. That's dimpling of the skin of the breast. Then inversion of the nipple or other parts of the breast. Those are some signs when you feel you need to go for a proper routine check to know if you actually have a breast cancer or not. But it is good to always examine your breast for early detection of changes and act promptly if need be. Then another thing we call breast cyst. These breast cysts can be caused by estrogen dominance. I've talked about estrogen before. It's an hormone. So it can be caused by estrogen dominance or use of oral contraceptives, hormonal imbalances, and certain stimulating foods. But the solution to this is in lifestyle change. You have to change your lifestyle. You avoid fried foods, avoid fatty foods and processed foods, and also caffeine. You avoid meat and estrogen-like compounds. You avoid sugar. So it is better to drink fresh organic vegetable juices daily. This can actually help you when you have breast cysts. Then also nipple discharge. Discharge from nursing mother's breast cannot be ruled out. That can be ruled out. But you know, when you don't have any, you are not breastfeeding, you have nipple discharge, that means you have to go for a proper checkup. It means there is a problem, so you have to go for a proper checkup. So when you notice all these things, you have to go for routine check. Go for a proper routine checkup to be on a safer side. It makes you detect if you have a breast cancer or not. So it is better you make sure that you maintain healthy weight, watch your diet, do all this in order to prevent breast cancer. And make sure, especially when you are from 40 years, make sure your diet is rich in fruits and vegetables. It should be more of fruits and vegetables. So when you go through all this that we have mentioned, it will actually help you in preventing breast cancer. To take care of your breast, it will actually help you. So it is better to make sure you are watching all this in order to prevent breast cancer. Make sure that you eat right, not just eating well. Make sure that you eat right. It is better. And I've told us before that when you take more of fruits and vegetables, it really helps you. It helps you a lot. in preventing breast cancer. So if you have anyone that have developed breast cancer, or you have maybe a sister, a mother, because I know that no man will want his wife to develop breast cancer. No mother, no son, will want his mother or sister to develop breast cancer. And no child will want his or her mother to develop breast cancer. So need to like and share this video to others who can also benefit from it and know how to prevent breast cancer and how to take care of their breast, to know the kind of foods they should eat and the kind of foods they should avoid to prevent breast cancer. So like and share this video to your friends, to all women that you know. And you can, if you have any question concerning this, or you want a remedy for breast cancer, maybe you have anyone that have breast cancer, you can visit us at our clinic. Our clinic is situated at number 51 Abiodun Oshudiya Street, Meron, Agbado Jaya, Lagos. Or you can speak with a doctor on 081-0460-7130. And you can also follow us on our social medias. You can follow us on Twitter at Embee Holistic Care. You can follow us on Instagram also, Embee Holistic Care. And also subscribe to our YouTube channel to get more videos, to learn more when it comes to different kind of ailments. My name once again is Dr. Abiola Olusegun. I'm an Embee medical practitioner. Thanks for joining us.